Welcome to Food for Thought, Brown Bag Lunches Online with Dr. Russell. Our topic today is gluten-free, pros and cons. Is it right for you? Every day I have patients who come in with digestive issues. They complain of gas, bloating, diarrhea or constipation, even indigestion, and related symptoms such as headaches, rashes, and irritability. Very often we find that these are due to food allergies, and often one of the biggest culprits is actually gluten. So as we talk about their symptoms, the idea of going gluten-free comes up. While going gluten-free is all the rage right now, there are some very real medical reasons to avoid gluten. In other words, it's much more than a fad. At its most extreme, gluten sensitivity is celiac disease, or the genetic inability to digest gluten. But many people can actually be sensitive to gluten and have symptoms from eating it. Studies show that even up to 70% of cases of irritable bowel syndrome are caused by gluten and dairy sensitivity. So in other words, going off of gluten can improve your gastrointestinal symptoms very rapidly. We also have seen that many autoimmune disorders, such as Hashimoto's thyroiditis, rheumatoid arthritis, lupus, and even vitiligo, can be aggravated by gluten sensitivity. In truth, gluten sensitivity is really the sensitivity to two proteins found in certain grains: gluten, which we all hear about, and gliadin, lesser known but still as significant. So we've talked about those who are genetically unable to break down these proteins. And in fact, in celiac disease, the villi of the intestines flatten and the ability to absorb nutrients is very much impaired. At its most extreme, many with celiac disease actually have chronic diarrhea and an inability to absorb nutrients or malabsorption that can show up as nutritional deficiencies. We see similar problems with gluten sensitivity, however, and some people actually suggest the problem is the type of wheat that is now being grown here. Dr. David Perlmutter, a neurologist and researcher who's been touted in the literature for his work with Parkinson's disease, he wrote the book Grain Brain, and he's very knowledgeable on issues related to brain health. He suggests that eating grains at all should be avoided, except for maybe a little bit of rice. I'm not telling you to do that here right now, but actually suggesting looking at your intake of gluten-containing foods and seeing whether there's an impact on your health. So where do you begin? What do you decide to do in terms of going gluten-free? And I recommend you do this with a doctor who's skilled and knowledgeable in food allergies and gluten sensitivity. Some people will choose to actually do a stool test, which is the most accurate way to assess for gluten sensitivity. And you can even do it up to a year after you have stopped eating gluten. That's how reliable that particular test is. Then you would want to go gluten-free, and I mean significantly gluten-free, not a few days, a few weeks, but out at least 2 to 3 weeks. It takes close to 6 months to 3 years to recover from the damage to the villi of the intestines if you have celiac disease. So if you're gluten sensitive, give yourself time to see whether there's improvement in your symptoms. And the only answer here, there's not a drug or a supplement or anything anyone can give you. You really want to avoid gluten. So you say, okay, well, can I go to a birthday party? Can I have an occasional this or that? Sure you can, so long as you are avoiding gluten most of the time and you're giving your body an opportunity to actually clear it out of the system. I'm speaking from personal experience here. About 5 years ago, I became gluten-free. It wasn't because I thought I had any particular symptoms, but I wanted to identify with my patients. I was asking them to do this, so I should do it myself. And you know what? To my surprise, my afternoon fatigue went away. I'd had it for a long time. I just thought that was me. Maybe my adrenals were shot. No, it actually was the gluten. So, and I even use that as a benchmark. If I get a little bit tired in the afternoon, I ask myself, did I get any gluten in what I was eating today? Now, you may want to know what foods contain gluten, and it's pretty simple. Anything containing wheat. Also spelt, rye, barley, and a little known one called triticale, which is a combination between rye and wheat, but it can show up in refined foods. Gluten-free foods are buckwheat, millet, quinoa, amaranth, corn, rice, and those types of grains. Those are most commonly used as substitutes when you're going gluten-free. Oats are gluten-free, but there are some with celiac disease who cannot eat oats either. And so I recommend, if you are celiac, you avoid the things that you've been recommended to avoid. Some of it might be cross-contamination with growing oats on the same fields as wheat are grown, or in the processing. So make sure you choose things that are certified gluten-free if you know that you cannot tolerate them. We also see cross-reactivity. For example, some of the grains I mentioned that are gluten-free can cross-react in ways that actually act in the system similarly to gluten-containing foods. And gluten and dairy also have this ability to be cross-reactive. In other words, they cause similar symptoms in some people. Now, I also, at the top of this talk, I mentioned the negatives or the cons, the reason not to do this. I'll be honest, there aren't many reasons to continue eating gluten if you're sensitive. I would say don't just join a fad and go gluten-free if you don't have symptoms or testing hasn't shown that. However, explore it, because I've had, as I mentioned, I didn't have symptoms, and going gluten-free improved my life tremendously. Gluten-free replacements contain many flours that in some people can contribute to weight gain if they're consumed too freely. So what you want to do is monitor your intake. And that leads me to the topic of too many carbs in general. We tend to eat too much bread, too many carbs, too many things that add on the pounds without thinking about it. Bread has become ubiquitous. We eat it all the time. So I would say, where you can with gluten-free products, look at how you're using them and back down on using them too much. I guess I would say, in the pursuit of health, it behooves you to look into this problem, see if this is contributing to things like mood issues, sleeplessness, symptoms related to poor digestion, and see whether gluten and perhaps other food allergies could be contributing to those problems. Get them tested, talk with a doctor who knows what they're doing in this area, and see whether you can overcome those symptoms for your optimum health. Thank you for joining me for lunch. I'm Dr. Russell, Tahoma Clinic doctor, and I look forward to talking with you soon.